Thank you for joining us for our webinar, The Psychosocial Aspects of Managing Food Allergy. I am Ranjit Angel, Vice President of Engagement at Food Allergy Canada. Our Back to School campaign is underway, and as part of that, we want to help build confidence in managing the psychosocial aspects of food allergy, including how to navigate across ages and stages and how to deal with bullying. Before we get started, I want to note a few items. This session is for informational purposes only and will not provide specific medical advice, recommendations, diagnosis, or treatment. Please talk to your doctor about any concerns or questions you may have regarding your own health or the health of your child. All participants are muted so we can keep the audio clear for the webinar. Thank you to everyone who submitted questions upon registration. There are some common questions that we will tackle in today's session. If you have additional questions during the session, please submit them in the question box throughout the webinar. We will try to get to as many questions as we can. This webinar will be recorded and shared on foodallergycanada.ca afterwards. Now, I would like to introduce our expert speaker today, Dr. Linda Jones Herbert. She is an associate professor in the Department of Psychology and Behavioral Health at Children's National Hospital and an associate professor in the Department of Pediatrics at George Washington University School of Medicine in Washington, D.C. Dr. Herbert is the Director of Research and Clinical Services for the Division of Allergy and Immunology at Children's National. She is an NIH-funded clinical researcher whose research interests include the identification of medical and psychosocial factors related to adjustment to food allergies and the development of clinical interventions that support patients with food allergy and their caregivers. Thank you, Dr. Herbert, so much for joining us. I'm now going to pass it over to you and invite you to also turn on your webcam.
So thank you so much for that introduction. As I said, I'm really happy to be here with you all today and love talking about this topic. So we're going to have about an hour to discuss the psychosocial aspects of managing food allergy. And I'm going to try to cover a pretty broad set of topics. So I have some objectives here for you all. First, we're going to talk about anxiety and depressive symptoms and how they intersect with food allergy. Subsequently, we're going to talk about some strategies that you can use to cope with food allergy-related anxiety and depressive symptoms. And we're going to transition then into some age-specific food allergy-related stressors and coping strategies going from infancy up to young adulthood. We are going to touch a little bit on bullying and social challenges. And then at the end, I have some general coping strategies that I work on with patients of all ages. So I'm hoping that this will address a lot of the questions that you have today. So let's first talk a little bit about the difference between everyday anxiety and anxiety disorders, because these are different things. When we think about anxiety, we think about a feeling of worry or nervousness or unease that might be preceding a specific event or sometimes is associated with something that is a bit uncertain. And what's important to note here is that this is a very typical human emotion. And at times, like responding with anxiety to a stressor can actually be a little bit helpful. So we all experience anxiety. And when we think about this in the context of food allergy, there's some common things that come up that I see in clinic and with my patients all the time that cause anxiety and are really normal responses and can actually in some ways be adaptive responses that help keep you safe. So one is feeling nervous or anxious at times about allergic reactions. That's helping you be prepared. It's helping you kind of think through what it is that will help keep you or your child safe. Another common anxiety that we find is family or friends or partners or just other significant people in your life not understanding or accepting food allergy. Another thing is taking on the responsibility for managing food allergies. And a lot of times we see this in particular when families are first diagnosed and are first dealing with food allergy and having to cope with that. And then there are other times throughout the course of the lifetime with food allergy when it's very normal to feel anxiety as well. And that may be some things like oral food challenges, which makes sense that you feel anxious. You're being asked or your child is being asked to ingest something that they've been told to avoid. And also decisions about food allergy treatments, especially now that there are some more treatment options, and in the US, even now, some more treatment options for epinephrine autoinjectors. However, anxiety disorders are something a little bit separate. So this is something when you have an intense, excessive, or persistent worry and fear about everyday situations that interfere with daily activities, that feel really difficult to control, that might be out of proportion to the actual danger, and that can include physical symptoms and might last for a sustained amount of time. And anxiety disorders can have a biological or genetic basis, and typically respond really well to evidence-based treatments such as cognitive behavioral therapy or medication. So examples of these are generalized anxiety disorder, social anxiety, PTSD, separation anxiety, panic disorder, or phobias. Here we have a table that gives you some examples of what might be everyday anxiety, but then what might push that into an anxiety disorder. So an everyday anxiety might be worry about paying bills, about getting a job, about a breakup, but an anxiety disorder would be constant and unsubstantiated worry that's causing significant distress or is interfering with daily life. So something that's kind of preventing you from being able to do all those things that you want to do, or might be preventing your child from doing all those things they want to do. It's also very normal to feel embarrassed or self-conscious in awkward or uncomfortable situations, but it gets to the level of being an anxiety disorder when you're avoiding social situations for fear of judgment or embarrassment or humiliation. So you see that difference is that not just feeling the emotion, but engaging in avoidance behavior from normal everyday activities. It's also very nervous to feel a little, or very normal to feel a bit nervous about a big test or a presentation. I'll admit I'm a little nervous giving a webinar. That's all very typical. What is less typical and what's in an anxiety disorder category would be out of the blue panic attacks or preoccupation with this fear about having another one. It's also very normal to have realistic fears of dangerous objects or places or situations, but when it comes to being an irrational fear or avoidance of daily activities or situations that don't pose as much threat or danger, that would be an anxiety disorder. And then additionally, when we think about anxiety, sadness, difficulty after a traumatic event, such as an allergic reaction, that's very normal. What's less normal, what might get us into the anxiety disorder category, is recurrent nightmares, flashbacks, and emotional numbing that might occur for months or even years. When I think about stress and anxiety in the context of food allergy, there's a couple of categories that come up a lot. One is certainly very predominant, and that is anxiety about allergic reactions and stress about allergic reactions. We hear a lot from families that, that uncertainty about when it could happen, whether or not they can control whether it can happen, and what will happen if an allergic reaction does occur, if they will know how to use treatment, if they will be able to use treatment, things like that. We also are increasingly hearing some anxiety about social interactions as well. So we hear about worries about what others might say or respond, how they might respond in times when someone might be advocating for their food allergy needs or their child's food allergy needs. And this is something that I think we're starting to give a lot more attention to in our own clinic. We also certainly see normal stress and anxiety about introducing new foods. And I see this in a couple of different categories. One is among parents of very young children who have understandable concerns after a child has had a first allergic reaction about what might happen subsequently when they introduce additional foods. So we might hear, there's these, other, soy, wheat, or things that we hadn't thought about introducing, and now that my child has had a reaction to cashew, I feel very nervous about that. That's something that comes up quite a bit. The other way that we hear about this is in the context of food challenges. So if a child tolerates a food during a food challenge, then of course they are recommended to keep that in their diet. But it's very normal for kids to feel concerned or anxious about having that food every day. perhaps that they've had like an aversive reaction to it due to their experiences in the past. We also hear about stress and anxiety in the context of medical procedures. And now that there are a growing number of available treatment options for kids with food allergy, this is certainly coming up. Blood work, skin prick tests, other procedures that might come up, like eating doses of things, like that is certainly something that can cause anxiety and worry. We also hear about concerns about other caregivers. So worry about, will someone else be able to take care of my child the way that I would like them to be? School, babysitters, other situations like that. And then I also hear a lot of worry about future food allergy management. So what's going to happen when my child is old enough to be on their own? What's going to happen when they, have a job? What's going to happen when they start to have romantic partners? That is something a lot of families kind of project far into the future as they think about how their child will do. And then we have worries about medical decisions now that there are more treatment options becoming available. And the way that these kind of present to me, and I'm showing these so that you can kind of get a sense of these different domains that I'm looking for. One is physiological. So anxiety can present as a hypervigilance to physical symptoms. And what happens, and I'll actually touch on this in a minute, is that symptoms of an allergic reaction and symptoms of anxiety can be really similar. A rapid heart rate, a queasy feeling in the stomach, perhaps getting, feeling your heart beating faster, taking more shallow breaths. All of that are these physiological symptoms of anxiety that can also look like an allergic reaction. So sometimes in kids, or we'll see parents being really vigilant to what is happening in the body and really sensitive to what is happening in the body. This also presents in a cognitive component. So worry about allergen exposure, rumination, having a hard time falling asleep, having a hard time, getting ready for some of these events that elicit anxiety. A lot of this is just like the what if. So what's going to happen if this happens? What's going to happen if this happens? Or what I call catastrophizing. So kind of going from 0 to 100 really quickly and thinking that the worst possible outcome, the catastrophe, is going to happen. And then what our allergists see quite a bit, and certainly what you might be noticing before some of the cognitive piece in your kids, is changes in behavior. So we'll see social activity avoidance, perhaps avoiding, going to, the restaurant after a soccer practice, or avoiding going to a birthday party. We also see food avoidance. And of course, food avoidance is necessary of unsafe foods, but sometimes we'll see that individuals will avoid foods that are safe, perhaps because they remind them of the food that they're allergic to or it's similar in some way. An example that comes to mind here is wheat. I'll sometimes see kids who have a wheat allergy, and then any type of bread or cracker is something that makes them feel a little bit nervous and anxious, and they might be less inclined to eat those foods. And then we also see the behavior of checking. So asking over and over and over if a food is safe, looking at a label multiple times. I'm not talking about looking at a label once or asking once. Certainly that's an adaptive, appropriate behavior, but when it's happening over and over repeatedly, when you're kind of doubting what you've seen or what you've heard. And one of my dear colleagues, Dr. Nancy Rotter, who's a psychologist at Massachusetts General Hospital, she's developed and has allowed me to show you this careful continuum, which she thinks about a lot with families. So there's this whole continuum of how careful families are with respect to food allergy management. And it reflects, an ability or, a certain thought about how much risk is acceptable, and what it is that the family is willing to kind of engage in. So on the one hand, this careful side, we have families that are eating at home, that are eating lunch at school that's provided by the school, that are checking ingredients and labels, that are participating in social activities. And then families and kids who are really careful, they might be taking some extra precautions at home, so seeking reassurance, washing, hands a lot, They might be separating themselves from eating lunch with others in school. So perhaps they're eating lunch at the nurse's office instead of in a cafeteria. They might be checking labels, 5 times instead of once, and they might be limiting their participation in social activities. And then we have individuals who fall on that really, really careful end of the continuum, where they might even be kind of restricting their eating at home and unwilling to eat certain foods at certain times. They might not eat at all at school. They might be checking labels many, many times, more than 5 times, and they might completely not participate in social activities. And so if you think back to what I was saying about like normal worries and then anxiety disorders, if I was seeing all of these different patients, I'd be thinking a lot with them about, whether or not what they're experiencing, what their worries are, if that is kind of getting them into this realm of avoidance and like really not engaging in the things that are important to them or not. And I had mentioned that, there's this overlap between symptoms of an allergic reaction and symptoms of anxiety. And I just want to touch on that a little bit more. So this is something that we've been thinking about as a group of psychologists for a while now in this food allergy space, and have been thinking through how to help families with some of this. So the first thing is to just acknowledge that the physiological symptoms of anxiety can be similar to symptoms of an allergic reaction. I think knowing that is a little bit of power, because then that allows you to then pause and kind of think through what might be happening in the body. But certainly it can make decisions really confusing. And at times we do see that patients will use medications more than they need to, or that they avoid activities or foods that are safe because they might be experiencing some symptoms that they're uncertain about. And what we know is that avoidance is a very good way to make anxiety go down. If you're not engaging in that thing that makes you nervous, then you're not going to feel as nervous. But at the same time, it can negatively affect life and can kind of make it feel more constrained, or can make it feel like it's hard to navigate. So when we think about what to do about this, we try to consider a few things. One is that the nature of anxiety is that it can wax and wane, and then eventually it can resolve on its own. Whereas symptoms of anaphylaxis generally do get worse over time and require medical attention. So we can think about and take a pause of what is happening in this moment with what I'm feeling. How is it changing? How is it progressing? We also know that anxiety is more common than anaphylaxis. So if symptoms are mild, if they're vague, if they're not progressing, it can be okay to take some time to consider if you should require medical care or if you should monitor symptoms. And you absolutely should be talking to your child's healthcare provider or your own healthcare provider about what it is that would require medical care, what would require treatment. But this is something that you can be kind of talking through with them about how would I know? How could I decide? Some questions that might be helpful to ask yourself as you're going through this are the following. So one, you might want to ask yourself, is this a situation where I was already feeling a bit anxious? Like, was I anxious before I even got here? Was I anticipating that something might happen? Was I worried about it? Or is this a stressful place for me in general to be? That might be kind of priming you to feel a little more anxious already when you're there and to have some of these symptoms. Another question that could be helpful pertains to what's been eaten. So has only familiar food been ingested, or has nothing been ingested? Has an unfamiliar food been ingested? And is there a way to find out the ingredients? So these are some other kind of extra probes, some evidence that you can be looking for to help you make that differential between anxiety and allergic reaction. And then, of course, it's always really important to think about comorbid conditions like asthma. And so you might also ask yourself, has this person been in a situation where those triggers have been present? Have they exercised recently? Maybe are there other cofactors that are coming up here? So absolutely, you can talk with your medical provider about how to help you work through some of this. But these are some questions and tips that we give as families are trying to figure this out. So let's next turn and look a little bit at the difference between sadness and depression, because we certainly get questions about this as well. So much like anxiety, sadness is a very normal human emotion that we've all experienced. We're all going to experience it again. It's triggered by difficult or hurtful or challenging or disappointing events. Typically, we feel sad about something. So that also means that when something changes or when our emotional hurt fades, when we've adjusted or gotten over the loss, then our sadness kind of goes away. And in the context of food allergy, here are some examples. Missing out on activities because of food allergy, feeling isolated in order to avoid embarrassment about allergy, when you've been bullied or when your child has been bullied, or when you maybe are reflecting or thinking about how food allergy might affect you or your child's future. Depression, in contrast, is a cluster of symptoms that persist for 2 weeks or longer, and we'll see very specific changes, sustained changes in mood, a disengagement in pleasurable activities. So, this might be if, you're really into playing tennis or your child's really into playing tennis and suddenly like they just don't want to do that at all anymore. Changes in appetite. This could be either increased appetite or decreased appetite. Same thing with sleep. You might find sleeping more or sleeping less. Restlessness, difficulty concentrating. And much like anxiety disorders, there can be a biological or genetic basis. And similarly, therapies like cognitive behavioral therapy and medication can be effective. And this is just a little illustration via cartoon of what these differences are. So normal sadness might be something like, oh, I studied so hard, yet I couldn't pass the exam. Whereas depression would be kind of negative feelings about the future, about the self, and about the world at large. And so here we have someone thinking, my parents are always quarreling. It bothers me so much. I don't feel like studying or doing anything. I don't have a future. I hate my life. There's a lot of withdrawal and things like that. So when you're thinking about, whether or not what is happening for you or for your child is typical sadness or depression, these are some of the things to be thinking about. So let's next turn to thinking through a little bit more about child development and what we might be doing in the context of food allergies at different developmental ages. So, you all know that there's big changes from an infant even to a 3-year-old, from a 3-year-old to a 7-year-old, from a 7-year-old to a 13-year-old, and from a 13-year-old to a young adult. So there's a lot that's happening, and we have to adapt, and our food allergy management and our food allergy coping also has to adapt. And what's notable here, I think, is that, there's all these different domains of change. So there's the way we understand food allergy changing as kids develop, but then there's also these social and emotional changes. So let's first kind of turn and think about infancy. So during infancy, infants are fully dependent on caregivers and on for all of their social and emotional needs. And so caregivers have to adapt to new diagnoses, and they really do benefit from support and guidance. And a specific challenge that we see during this time is the introduction of new foods. And this is because of that concurrence with food allergy diagnosis. So it can make it very complicated to reintroduce foods. And this is something that actually, as we were talking about some of the common questions for this session that we got in advance that came up, we have families that feel anxious about new food introduction, or they might feel anxious if an older sibling has an allergy and they're uncertain about what to do with the younger child. So I'm not here to give medical advice, of course. I would always recommend talking with your child's physician about what foods they believe are safe and at what time to introduce them to their child. However, we can use some principles that we know from cognitive behavioral therapy to help with the anxiety that might come from that. So here's an example of like what I might do with a family in clinic. Let's say that there are 4 foods that the child's healthcare provider has recommended they introduce. I would be thinking about, as a parent, how do I feel about those different foods? Is there a food that I'm really anxious about? Is there a food that I'm less anxious about? Can I rank them and think through what would I do first? And I would recommend then starting with the food that you maybe are least anxious about to give you some opportunity to build a little bit of confidence. And I would think about the setting and the time. So perhaps you know that if you try to introduce a food when you're also giving your child the rest of a meal, that might make you feel more anxious, because if something happened, you wouldn't know what to attribute that reaction to. If that's the case, then introduce this food at a time by itself. You might also feel more comfortable if there's someone else that's at home with you, another adult who knows what to do. If that's the case, plan and introduce a food at that time. Similarly, we know that when we are really busy and we have a lot of competing demands, it can be really hard to think clearly, and it can make us more anxious as well. So perhaps thinking about what is a time of day or a day of the week when I know that I have a bit of time to feel clear-headed, when I'll be able to monitor my child the way I want to, so that I'll feel more comfortable. So talking with the allergist or the healthcare provider, ranking from least to most worried, and then giving yourself a time and a setting where you will feel least anxious. Here I also have some of these other coping strategies. So really seeking support from your pediatrician or allergist and availing yourself of online resources. I love the resources that Food Allergy Canada has. I actually use them with a lot of my own patients because I think they're so wonderful. So using resources that you're finding on websites like this. And then really focusing on communication. So ensuring that everybody's on the same page about how to keep your child safe. When we get to preschool, there's new challenges, of course. So kids ages 3 to 5 are starting to become more independent. They're walking, they're exploring, they're learning their limits, they're using the word no a lot and trying to do things their own way. And what's notable about their cognitive development here is that they engage in a lot of concrete thinking and think about cause and effect. And they also are thinking about things as they just relate to themselves. It's that egocentrism. Their caregivers and family are still their primary supports, but they are starting to develop peer interactions as well. And a lot of times emotions are perceived as being external. When I think about coping strategies for this, I start thinking about how do we educate the child that has food allergy? And what I like to emphasize is the importance of using really concrete, clear, simple language. So an example might be, this is your wheat-free bread that is safe for your body. Or I might say, you have a wheat allergy. This means that if you have wheat by accident, it could make you sick and you might need some medicine. But then I pair that with saying, but mom knows how to keep you safe. And if you do need medicine, we know what to do and we can give that to you. We also teach really clear things like you ask mom and dad before you eat a food. If somebody gives you a food, you bring that to mom or dad. We don't share food. So really clear things that your child can understand. We also recommend starting to model safety behaviors. So even though we're not asking kids to be responsible for their food allergy management at this age, we can start to show them what it is that we do. And kids are little sponges, so they're going to start to notice and to think about this stuff. So you can go to the grocery store with your child and pick up a bag or a box of something and say, oh, I'm just looking to see if this food has wheat in it, because if it has wheat, it's not safe for you. That's just starting to show them what you're doing. Or when you're leaving the house, you probably would already have a routine, like we go to the bathroom, we put on our shoes, and mommy grabs her bag. Well, you could just add to that, and mommy's taking her bag with all of your allergy medicines in it. This is what we do to make sure that we're safe when we go outside. And then additionally, educating others still is really important about safety plans and planning for food-related activities, because this certainly comes up more, perhaps having some non-perishables at school if needed. Then kids kind of get to this school age, ages 6 to 12, and the developmental tasks here are to really start negotiating school and friendships a lot more. These kids are still engaging in concrete thinking, but they are starting to be able to understand more abstract thoughts. And this is where I start seeing kids understanding a lot more about food allergy and about their immune system. And when they start to have a lot more questions about like, well, why am I allergic? And why does this happen? And there's just so many whys. These kids are so intellectually curious at this age, which I love. But it means that sometimes parents are uncertain about like, how do I answer these questions? They also have a real importance of family, but peer connections are becoming increasingly supported. So that's when we're thinking about play dates and birthday parties and extracurricular activities. And feelings are more internal at this point, but are still expressed very much externally. So this is when I start thinking about the use of role playing to help kids. So I like to think ahead of situations that might be coming up, like going over to a friend's house and they offer you some food, or going to a restaurant, and you can start to like really model to kids the language that they can use, so that they have something kind of ready to go for. This can be really helpful. You can also be doing this through like play with different, toys or stuffed animals. I have a 7-year-old. She loves imaginative play still. And so you can act things out with toys. And I do that pretty regularly. You also can start to prepare and support kids for challenging peer situations, like bullying through role play as well. And you can start to collaborate with kids about how they want to handle these different situations. So they may have their own preferences. You can start to ask them, like, when we go to this birthday party, we could either do this or we could do this to help keep you safe. What would make you feel best? How would you like to prepare? And you can start to use more detailed information about food allergies and managing risk. So this is when we talk with kids about, the similarity of other safety behaviors. So we wear a helmet when we ride a bike, we check a label before we eat a food. During adolescence, there's a lot of developmental tasks that are happening. And we don't have to go through every single one here, but I'm just kind of trying to show there's a lot that's changing. So there's different perceptions of yourself. Kids are trying to figure out, like, who am I? And how does food allergy fit in to who I am? And they're able to engage in a lot more complex thinking, so they can plan more for food allergy. But at the same time, they're away from parents more. They're identifying more with peers. So feeling like you belong, feeling similar, is really important too. So this is where parents might kind of feel confused as they see this kind of two opposing things of, my child knows how to plan and can plan ahead for food allergy, but I don't see them actually doing it. Or like in that moment, they're not speaking up when I think that they should. So that can be confusing for families. And this is also when they're first starting to navigate romantic partnerships, when they might be going to have jobs for the first time and they're starting to think about living outside the home. So here, we really recommend practicing open communication with adolescents. So, trying to be really direct with them about things, because they can understand way more about their food allergies at this point. And one of the things that I actively do in one of my projects with early adolescents is almost give them like a re-education in food allergy, because one of the things that I think happens sometimes is that because kids are diagnosed when they're so young, we have assumptions about what they already know and understand about their food allergy. But the more that I talk with them, the more I hear some kids say, well, I just do it like this because I always have, but no, I don't actually really know what my food allergy is, like how it works. And so providing them with information and like really respecting that they are capable of understanding this is helpful. We also like to think through having conversations about who should know about food allergies. And this is in contrast to when kids are younger, when a lot of times everybody kind of knows about food allergy in their class. When kids are older, not everybody maybe needs to know about their food allergy, but some people really should. Certain adults definitely should, and certain peers who they're spending a lot of time with definitely should know. So talking through with teens about who should know, who's kind of a non-negotiable from your perspective that needs to know, and who maybe is there a little bit more decision-making with your teen. It's also important to start talking through other safety and management concerns. and really giving your child, your adolescent, time to speak with the allergist or the healthcare provider independently too. They might have questions about romantic partnerships, about kissing, about dating, about alcohol, about all these different things that are really important questions for them to ask. So giving space and allowing them to talk about that is really important. And this is also time to start thinking about the transition of care as well. So we certainly don't expect that kids who are 13, 14 are the ones picking up prescriptions and calling them in, but it's a time when they can start to learn how to cook their own allergen-free meals, and when they can be kind of shadowing you a little bit more on that front. So thinking about all these things can be useful. And then with young adults, certainly again, reviewing how and when to use epinephrine, clearly communicating with roommates about allergies and safety practices. If they're moving away from home, thinking more about where there are local resources and talking through with them about when to seek support, when to get help from others, and modeling and acting in self-care. So I do just want to take a little time to make a note about bullying. One of the projects that I've done with my research team has been to document a little bit more about food allergy related bullying. And one of the studies that we did allowed us to ask both parents and kids their own perspectives. And we also asked both a yes/no question and an open-ended question where they told us on this checklist that you see here if any of these actions had occurred. And what we found when we compared parents and kids is that parents frequently were not as aware of bullying as maybe they would like to be. So there was a disparity in the level of bullying that parents reported versus kids. The other thing that we noted is that there was a big difference in what kids said based on how we asked it. So if we just asked them, have you ever been bullied for food allergy? Only 17% said yes. But when we asked them about all these other different things, we found that almost twice as many said that they had experienced that. And I think what might be going on here a bit is that people are defining bullying in different ways in their mind, and we don't have a common definition. But if we ask more open-ended things and ask about these other behaviors, then people might start to realize, like, oh yes, like this has happened to me. So what I'd say here is that we might be missing food allergy related bullying if we only ask parents for what they know, and if we only ask kids yes or no. So kids, as I said, they might be uncertain about what bullying behavior is, or they might feel embarrassed. They might think nothing can be done about it. And families are just really busy, so you might not necessarily know about it as a parent because it just doesn't come up. So these are some ways that I recommend asking about food allergy related bullying. One is that you can ask really direct questions. So you can ask things like, has anyone ever teased you? Have you ever not been able to eat your lunch because someone put an allergen in it? Things that kind of correspond to that checklist that we had. But also, I think there's some real value in asking open-ended questions about peer experiences. And this is something that a parent can be doing, say, over the dinner table or while riding in the car. A lot of families, including myself, we experience that, these car rides, say to soccer practice or ballet class, like they really can facilitate some nice conversation. But this is also applicable to healthcare providers and educators. Asking these open-ended questions gets you more. So things like, tell me about your friends at school. Who are they? Have you ever talked to them about food allergy? And what did they say? So I wouldn't necessarily ask all those things in a string like that, but kind of using those as prompts as you're going through the conversation. Another example might be, oh, tell me what it was like for you at lunch today. Where'd you sit? Who'd you eat with? Or, have your friends ever supported you with your food allergies? How'd they do that? Or has it ever been challenging for you to deal with food allergies at school? What did you find hard? How'd you handle it? Is there anything that you think would make it better? So these are things that parents, healthcare providers, educators could all be asking. And then, of course, if we ask about this, we have to be prepared to be able to do something about it. So parents and others can really be doing some of the following. So one is, if your child is being bullied, ask them about their experiences at school with meals and social activities to gather even more information. Talk to other adults at the school, such as a primary teacher, a gym teacher, whoever's in the lunchroom, to see what they're noticing. And then every school is different, of course, with their bullying policy. So ask about that policy, get teachers and administrators involved. And then consider if there are ways that could downplay differences. So there's kind of this two-pronged idea of what I think school should be like for kids that have food allergy. One is that they should be safe, but the other is that they should be included. And so it may be that they're being bullied because of that inclusion part. So are there ways to make the classroom or the lunchroom less different for food allergy kids so there are fewer opportunities to be bullied? That's part of the preventive piece as opposed to the intervention once it happens. And then for all kids, and this is something that I think applies even just about food allergy in general, is that it's really wonderful to expand your kids' social opportunities, to connect them to kids that have food allergies, or to connect them to activities that have nothing to do with food, so that they can start to develop friendships outside of that school or whatever that bullied setting is. That allows them to have a more robust social network, which then means that when bullying does occur in one situation, the impact may be somewhat, ameliorated. Okay, so now let's talk a little bit about some all-purpose self-care strategies. These are things I'm sure that you've thought about, but a big one is putting on your own oxygen mask first. So this goes, of course, to our parents in particular, who I'm sure know that like the best way for you to take care of your child is to also take care of yourself. So as I've been talking about anxiety and depressive symptoms, like if these are things you're thinking about for yourself, not just for your child, get help for yourself too. Another is practicing self-compassion. You are not going to be perfect all the time. You're going to make mistakes. There are going to be times when things could have gone better. You did not do anything to cause a food allergy in your child. And engaging in some self-compassion about this food allergy experience and allowing yourself to feel that whole range of emotions is really helpful. And the other piece of this is learning and practicing relaxation strategies for in the moment, breathing, imagery, meditation, yoga. That all is really helpful even outside of the moment to just kind of bring down a general baseline anxiety level. Scheduling daily self-care activities, because if we don't schedule them, we frequently don't get around to them. And maintaining and developing social connections. These are people that in those moments when you really need it can be there for you. We can also get a little more specific with some ideas to help you with coping. One is problem solving. So we like to teach the ideal technique, we call it, to anticipate and address situations early. And these correspond to our acronym. So the I in ideal is to identify the problem. From there, we define each aspect of the problem. From there, we explore all possible solutions, even ones that you don't think will work. We then act on the solution, and then we look back and reflect and make this an iterative thing if necessary. And I sometimes get questions for like what kind of an example can you provide? So here's an example that may fall in the food allergy realm or might resonate with you. So here we have a problem where my child gets upset if there's a class treat and they don't get a treat. So that's kind of like the bare minimum, like this is the problem. My child gets upset. Then we think about all the aspects of it, and there's probably a lot more to it, but I've just kind of listed here a couple of them. So one aspect is like, I don't know when they will have treats. Another is that sometimes the foods are safe, sometimes they aren't. So I don't always know, like, is this something my child could have? The teacher might not know. Another aspect is that my child comes home upset about not having the treat. And another aspect might be that the teacher is apologizing each time, but it just keeps happening. So there's a lot going on. I've listed 3 possible solutions here. I'm sure there are many more that you could be thinking of too. But in this brainstorming, things that came to my mind were asking the teacher to not allow any treats in the class, asking the teacher to only allow food treats that are safe for your child, or asking the teacher if your child can have a place to store non-perishable safe treats in the classroom for unexpected treats that they can eat at that time. And I kind of go back to this idea of like, even if you don't think a solution will work, list it. Like it might not work to ask the teacher to not to allow any food treats. So we might have to just scratch that one off. But it still kind of gets you thinking and gets things flowing. And then after you evaluate these, you pick one to try to act on. And it's okay if you try it and it doesn't work, but it's good to reflect and see, and then maybe you can go back to that list and kind of cycle through it again. Another strategy that we go over a lot is something called I statements. So this is a useful strategy for communicating with others about your needs. One of the things that's important to remember is that we really cannot control how others are going to feel or respond to our food allergies. I wish that we could, but we cannot control that. But what we can control is perhaps how the way we're communicating, how we're advocating, to give ourselves a good shot to be able to get where we want to be with things. And so this is a strategy that you might want to consider. So what's special about I statements is that it's centering the speaker. So it's centering you. And it's allowing you to be assertive without eliciting a defensive response from the listener. Because in this framework, we're not saying you. We're saying I feel, I need. So it's centering you. It's focusing on your feelings and reactions. And we use this so that we can express our feelings to someone without blaming them or making them defensive. And it can be a nice way to have a helpful conversation where you both get to explore the problem. So here's just a little bit of the difference between you and I statements. So a you statement would be, you always leave me out. An I statement would be, I feel hurt when I'm not invited to events because it feels like I'm not welcome. So you can see that there's a difference here. You can maybe anticipate that the way someone responds to the I statement might be different than the you statement. And here's an example that I use from the adolescent perspective in one of our studies. So a you statement might be, you're nagging me about carrying epi or something. The I statement would be, I don't feel trusted to carry my epinephrine autoinjector when you remind me about it every morning. And that hurts because I want to be someone you can trust. So again, you can see there's a really big contrast between the tone and perhaps the emotion that will be elicited in the other person. So the way that you can create an I statement is to identify your feelings, describe the behavior that bothers you, talk about how that behavior affects you, and then check that you're being assertive. And it's important to practice this. So here, if I just go back really quickly, you can see that, you're identifying the feeling. I feel hurt. Describing the behavior. I'm not invited. It feels like I'm not welcome. So you're kind of going through all these different things. All right. So I do want to make sure that we have time for our questions. So I'll come to some conclusions. So here we have our conclusions. So food allergy does require additional mental energy to plan and to prepare and to be ready for allergic reactions. That's really well documented in our research, but also what I have seen clinically in over a decade of working in a food allergy clinic. And it's important to remember that although some anxiety and sadness is normal, I want to validate that for you all, it is normal, but there are patients that experience elevated anxiety and sadness at a clinical level that negatively affects their life. But there are strategies that can be implemented. Cognitive behavioral therapy can be very helpful. Acceptance and commitment therapy can be very helpful. And even just trying some of the things that we've talked about today. And I will also just conclude by adding that if you're looking for a therapist, there are a few websites that can help with therapy directories. So Psychology Today is a great website. My friend Tamara Hubbard, who works out of the Chicago area, she has a website called the Food Allergy Counselor Directory. There's also Anxiety Canada. You can also look for your local province psychology associations. Many times they have directories on their websites too. And you can also go through your insurance company. So thank you so much. I'm really appreciative that I was invited to speak with you all today. And I'm going to stop sharing my screen so that we can switch over to our questions and answers.
Thank you so much for the very, very insightful presentation and for all the strategies. I'm sure it's going to be helping the audience and many, many more who will be viewing this session. So let's get to the questions that came in. So our first question is on traveling and managing anxiety. Can you speak a little bit about how you manage anxiety during travel or in unfamiliar places and environments?
Absolutely. So we hear about this a lot with our families. So I think that when it's time to travel, this is where planning ahead can be really useful. So we think through, first of all, well, where is it that you're going to? How are you getting there? Are you driving? Are you flying? And there's different things that you might need to do with medications, with food, in order to get there safely. And then when you're thinking about where you're going, your destination, do you have access to a kitchen? Can you identify where there may be local emergency services? Do you know where pharmacies are? Things like that. So planning and being prepared for all of those things. There's also really nice, like if you're going to a country where they don't speak your language, there also can be some really nice travel cards that actually spell out like how to say different allergens in different languages, how to say that I have an allergy. So I think being planful, kind of bringing some of those resources is one way to do that. Um, Going a little bit further, similar to how I talked about introducing new foods, it may feel like it's too much to go on a big trip right away, and that's okay. So you could also think about kind of taking travel step by step too. So maybe there's 3 places you would love to go. Think about which one of those might elicit the least anxiety, which might require the least amount of planning, and start with that. Start small so that you can kind of build some confidence and kind of just rip off that band-aid and see like what it really is like.
Another question is around allergic reaction trauma. So, is there a therapy method that you would recommend to heal OCD and anxiety associated with allergic reaction trauma?
Yeah, so these I think are slightly different things. So with OCD, there's very evidence-based treatments like cognitive behavioral therapy. So I would absolutely recommend something like that. And with respect to after allergic reactions, it is really common to experience anxiety after that as well. What I'm always kind of looking for is like, how long is this anxiety? And like, does it stay sustained or does it kind of go back down? And so for those individuals that have like this really sustained anxiety about it, that's also a reason to engage in a therapy like cognitive behavioral therapy. The types of work that I do with kids in those situations are very similar to some of these other things I'm discussing. So let's say there's a lot of question about how they feel eating in public again or eating in the cafeteria. We take very small steps to kind of get you back to a place where you feel more safe by maybe doing things in a stepwise manner. The other piece of this is that there may be confusion about that physiological symptom that's being experienced. So you might have kids who are now believing that they're experiencing allergic reactions a lot because of what had happened. And so that's where we provide education about anxiety and allergic reactions. We give a lot of psychoeducation about that and strategies to use to behaviorally manage anxiety, and then also cognitively address some of those worry thoughts that come up.
This one came in that I'll answer. It was a question from a parent whose 15-year-old has a lot of anxiety after having a reaction earlier this year. They're asking if there's any groups to help overcome a reaction and mentor. So we actually do have an online mentorship program called Allergy Pals and Allies for 7 to 15-year-olds. The program has been life-changing for participants in that they not only learn strategies to confidently manage their food allergy across different settings, but they also get the opportunity to meet others who are just like them and build a network of peer support from across Canada. So that's been very powerful to have that connection. So it's a free program. The next session starts September 21st, so you can register at foodallergycanada.ca/allergypals, and I'll have a slide up on that later as well. The
That
next
is so
question's on. Oh,
that. Sorry, I just want to reiterate, like that is so exciting to hear. And I agree, like peer support can be everything. Like one of the things that I noted about building self-esteem is connection to others and hearing how others do things. So having like a built-in program like that is beautiful.
Yeah, and like I said, the past participants, they keep in touch with each other. They really, like I said, they really do appreciate having the tips and tools that they're learning from the mentors, but it really is that connection and that feeling of having other peers, their same age, going through the same life challenges, the stages, to really have somebody to connect with has been so powerful. Um, the next question's on talking to others. So, how can people with food allergy explain to others about the support they need without them thinking they're being different or problematic? So, for instance, families and teachers, including a child advocating for themselves when their parents aren't around, or friends and
Mhm.
coworkers. Do you have any strategies you would recommend?
Yeah, I think I would kind of go back to some of the things that I had talked about throughout the webinar and acknowledge like it's really tough. And as I said, like we can't make everybody take food allergy seriously. That's the reality of it. I wish that I could, but that's not something that we can really control. Instead, what we can control is like how we're communicating about it by using things like our I statements and really start to examine like who are the people that are appropriate to have in our life that are supporting our food allergy management as opposed to like making us feel like we're running into a brick wall. With kids too, I think like really role playing how they can say things and reiterating to them like that you are allowed to say no to an adult. This is something that I know is really tough, but telling them like you are the one who is allowed to say no, like you told me that this food is safe, but I didn't get to look at the label. I don't eat anything from someone else. And allowing kids to kind of process and experience what that's like can be, and hearing from you as a parent that that's okay is important.
That's really powerful, I think, just in general, too, in terms of the ability to say no. This question just came in through the chat. This a parent has a son who's 9 who's had skin reactions to shrimp before, but they've been tested for allergy and are not allergic to shrimp. So they're having problems though on reintroducing shrimp back into his diet because he's anxious about eating it again. Even if he isn't allergic to it, he has a lot of anxiety around it. Is there anything you would recommend there?
That's a great question. So I think the first thing is really talking with the healthcare provider again, and it's I wonder if it's possible to do like an in-office kind of food challenge, like a demonstration that it's okay for them to eat it, and finding out like really having the child also hear your healthcare provider said that this is safe. But then from there, we'll do in our office what are called proximity challenges with kids, where rather than just saying, here's the shrimp, you know it's safe, eat it. We'll kind of start slowly and like have them kind of just get used to being around it and to like smelling it and to like seeing other people eating it and like, have it like touch a food and then eat the food that wasn't the shrimp but was near the food and like again kind of give them these slow steps that build some of their confidence in it. But it can take a little while to get there. And there's also times when it might not be the right time to introduce it again, right? Like perhaps as the child gets a little bit older, they think about it a little bit differently. But that's something that certainly a therapist could assist with. But given that we know not every therapist has food allergy expertise, it might be appropriate to have the therapist connect with the healthcare provider to find out a little more about what the needs are. And I do have with some colleagues a published paper about proximity challenges and it has a whole protocol. So a therapist could look for that paper as well.
Fantastic. I know we're running close to our time, but I want to ask one last question before I wrap up. And we had quite a few questions come in about dealing with exclusion, and how you can overcome not being invited because of an allergy and how to make food allergy more of a normality. So are there strategies you would recommend?
Yeah, so there's a lot to that question, I think. I think a big part of it is building friendships with people who do include you and like maybe focusing a bit on like who are these people that are able to connect with you and who take things seriously. for kids when they are excluded, really acknowledging, like, yes, that is sad. Yes, it's okay to feel hurt about that. And this might be where, as a parent, you then connect with the other parent. Like, don't necessarily involve your child with a big discussion with the parent, but maybe connect with the parent and find out, like, oh, is there like a misconception about whether or not my child can safely participate? Like, maybe have problem solving with that other parent, maybe using some of those I statements about ways that in future a child could be safely included.
Thank you so much, Dr. Herbert, for your expertise and your insight and your time today. It's been super valuable. I'm sure a lot of people are going to really benefit from using these strategies to deal with food allergy and even other things in life. So thank you. We're just going to turn off our webcams now, and I'll wrap up just with a few slides. Following this session, you will get a short survey through GoToWebinar that asks for your thoughts about today's webinar. Please take a moment to do the survey. It helps to inform our educational programming and provides us with insight on other topics you would like us to cover. Back to school is now underway, and if you haven't already, take advantage of the host of resources we have on our site. Go to foodallergycanada.ca/backtoschool. There you will find videos, handouts, hacks like the one on the screen, and more. And please do get involved in our More Than Peanuts social campaign, which is about creating awareness for all allergens to help prevent reactions. The posts are insightful and very shareable. All you need to do is share the post to help us broaden the reach of the campaign. We'll also have one more webinar this month, and that's going to be on food allergy versus food intolerance. Don't miss out on the session with Dr. Wade Watson. Register now at foodallergycanada.ca/events. Also, as I mentioned earlier, the fall session of our Allergy Pals Allies online mentorship program starts on September 21st. This program connects kids with food allergy from across Canada and has been life-changing for the participants. We'd also like to thank the following back-to-school campaign sponsors for this event: EpiPen and the Peanut Bureau of Canada. Thank you for your participation in today's webinar. You can view a recording of this webinar at foodallergycanada.ca. Please also share with others who may benefit from this content. This now concludes the webinar.